Hello, everyone. I am Reverend Nelson Rebel, pastor, mission developer for the Misión Latina Luterana in Stockton, California. I also work for Faith in the Valley as an educator and outreach coordinator for the COVID-19. And we have before us today, joining us, the YCC, the Youth Coalition of California. We also have my spouse and also Dr. Fabiola Ramos, who is both a dentist and a public health master's degree specialist. And we have a wonderful group of young people from the YCC that have joined us, a multicultural and diverse group of young people who will be talking to us about their experience of COVID-19, the COVID-19 vaccination and the vaccine, and how they have experienced not just the vaccine, but also their community's reaction to the whole process of getting vaccinated, especially young people. And first of all, we want to say that this project, this collaboration is supported by Kaiser Permanente, Northern California Community Benefit Programs, and Together Toward Health, a program of the Public Health Institute through funding from a group of philanthropic organizations. So we want to thank all these groups that have provided funding for us to get this type of outreach to the different communities, especially our young people who are being affected by COVID-19. So thank you. Welcome, everyone. Welcome, Jasmine, Cheyenne, Gabe, Rachel, Dr. Ramos. Why don't you all introduce yourselves? And I'll start with you, Dr. Ramos. Could you say a little bit about yourselves?
Hi, well, I am Fabiola Ramos. I'm a dentist that work at a community health center in Sacramento. I also have a degree in public health, master's in public health, epidemiology. So always looking to, follow the news on viruses, and especially at this time.
Thank you, Dr. Ramos. And Jasmine, and a member of the YCC, why don't you also share with us a little bit about yourself?
Hi, my name is Yasmin Ahmad. I'm 22 years old. I'm from San Joaquin County, a town called Lodi. I am a Palestinian American, and my community is made up of Middle Easterners. And I received the vaccine because I wanted to better protect myself and my community, a very social community. And I wanted to just that extra barrier of protection for when the world opened back up again. And I do not regret it at all.
Thank you. Thank you, Jasmine. Cheyenne, tell us a little bit about yourself.
Hi, my name is Cheyenne. I'm 18 and I just graduated from John F. Kennedy High School. I mostly grew up in Alameda County, and I'm from Honolulu, Hawaii. I just got fully vaccinated not too long ago, and I'm also have no regrets about getting it. And I feel great protecting my loved ones and my community around me.
Thank you, Cheyenne. Gabe, could you tell us a bit about yourself?
Sure. My name's Gabe. I'm 20 years old, and I'm from the 209. And yeah, I'm with the Youth Coalition of California. I was vaccinated roughly about a month and a half ago, and absolutely have no regrets about doing so, as it's been able to keep myself and others safe.
Thank you. Thank you, Gabe. Rachel, tell us a little bit about yourself too.
Hello, my name is Rachel Cantu. I'm from Galt, California. I'm 18 years old and I just graduated from Galt High School. I'm Mexican American, and I got the vaccine a little earlier this year. Do not regret it also.
Good, good. Thank you so much for sharing. And this is a great, first of all, I want to thank you all. I want to thank each one of you for being here and for sharing your time, your wisdom, your experiences. So let me ask the group a question. And have you heard, first of all, how was your experience when you got vaccinated? Like, tell us what moved you, maybe in a deeper, spend a bit more time telling us why you got vaccinated. Some of you have mentioned your love for your community, your family. Is there more reasons, or explain a bit more why, from what you have heard, in terms of the science and the needs of the community, especially communities of color, like the ones represented here. So Cheyenne, could you say a little bit about that?
Yes. So I know that a lot of my community, I'm Asian, I'm Filipino American. Mostly everyone that I know have greeted the vaccine um, with no hesitancy. We're very happy to want to protect everyone that we love, and we also are very social. So having those again are very much easier to do. And yeah.
Thank you. No, that's, I think our communities tend to be very social, right?
Right.
So what about you, Jasmine?
Yeah, so like I said earlier, I come from a Middle Eastern community, and we are very social. Like we thrive off of gatherings and get-togethers, even if it's not, like meals, just to be in each other's presence, not even just family, just anyone in the community. And so to have that kind of taken away was a new experience for a lot of these people in my community. They've never, had to be on their own. They've never not had that kind of support system, like right there for them. So that was a shock for a lot of people. But I also know that my community really cares for older members. The elders are highly respected and cared for by everyone. So to know that we could protect them and, like make it easier to see them again, that was definitely something that pushed a lot of members of my community to get vaccinated, just for their older, their parents, their grandparents, that they left their home countries to be here, and just to lose that for COVID when they could, have that kind of shield. I think that meant a lot to them. And that was definitely one of the big factors that pushed a lot of people to get vaccinated. And I'm happy to say that a majority of my community has received both doses of the vaccination. And as far as I know, no one regrets it.
Right.
Thank you. No, that's what a wonderful experience. So thank you. That's and reasons, right, to protect the community, the elders. That's wonderful. So I want to just ask Dr. Ramos, what are the numbers in young people? How is the COVID-19 and the new variant, the Delta variant, affecting young people in general?
Right. So we had the beginning of this pandemic, didn't put much attention on young people. There were myths also that were carried, partly because we didn't know much at the time, for sure, and also because myths were being spread, how it affected young people, children, and how it wasn't as bad. There were cases that were also risky on younger populations, but now with the new variant, with the Delta variant, it's not that new anymore. We have, you can get it so much easier, but also it's taking these younger populations and in hospital situations very easily. And so we are in the summer still. We're about to enter school time. And so we worry, pediatricians are sounding the alarm that the numbers are growing. And also on populations in general younger than 30, we're seeing a lot more cases, and not necessarily with underlying conditions with bad outcomes.
Thank you, doctor. So Gabe, you heard what the doctor said, and your experience and why you got vaccinated. There's some myths out there that sometimes young people have, and I'm sure all of you have heard it, right? And so what, in a deeper way, in a deeper sense, I'm sorry, what motivated you to get the vaccine?
For me, vaccination, I knew that I was going to get vaccinated early on in the pandemic, as soon as it was available. although after my parents or my grandparents, pardon me, contracted COVID and it nearly killed them, I knew that it was there was a new sense of immediacy that I had to follow through with. My grandparents were sick for nearly a month, and were nearly killed by it. And you know, from then on, it became I look at my getting the vaccine as necessity, you know, to ensure both my survival, but as well as those around me. You know, asymptomatic people have less of a chance to pass off the virus than, or pardon me, vaccinated people are less likely to be able to transmit the virus. And it's just a very scary disease. And watching, you know, my grandparents going through it and calling them and hearing the energy from their voices, you know, fading as the virus progressed. It was a scary moment in my life, and I knew that vaccination was going to better safeguard other elders of the community, and as well as myself, because young people, we are just not immune to this virus. It has the potential to be just as life-threatening to us as it does to elders.
Yeah.
If I may, I want to say something about, there's new things with the Delta variant, you know, some of the things that we had learned with the virus before have changed quite a bit, and it's important for us to know. So now vaccinated people, we are protected, a big level of protection from the virus, from contracting it. We could still see breakthrough infections where we get the virus these days, and we can transmit it. And our viral load, how many viral particles we carry with us, it's big. So we can certainly transmit it, and that's what's so important for vaccinated people. Even though we will not get necessarily a bad infection if we get the Delta variant, we can transmit it to others and give them a bad infection if they are unvaccinated.
Thank you for that.
I appreciate the correction on that. Thank you.
Yeah, no, it's good for all of us to learn, right? Like, as I'm listening to Dr. Ramos. So Rachel, you know, we're listening to all the different voices, you know, the Middle Eastern community, Palestinian community, Filipino, Asian, Mexican American, which you also represent, and young voices. What has been your motivation, given some of the numbers? And let me just say this, and doctor, correct me if I'm wrong, but when the initial hit of the pandemic started, I remember being taken by the numbers just here in California. At the height of the pandemic, in the first wave, first big wave, that 56% of the cases were Latinx people, and 46% of the death from COVID-19 related issues were Latinx. So our community in general in the state of California got a big blow by this pandemic. And Rachel, I know you know, knowing this and your experience, how this motivated you, knowing how our community has been affected. How did that inform your decision to get vaccinated?
So it hurts knowing that so many people within our community are affected by this. And as Yasmin said about our elders, knowing how much they sacrificed for like their family, it hurts knowing that we're willing to put them at risk not being vaccinated. So the reason I got vaccinated is for my family, of course, my community, to help us feel safe and have a sense of protection, and to attempt to have everything like go back to normal.
And that's so powerful what you just said, Rachel, along with what everyone else has said. So let me ask you all a question, and feel free, any of you, to jump in and answer it. What are some of the myths that you have heard among your peers, younger people, even within your own community? I mean, it doesn't have just to be young people, but let's start with younger people, or some of the myths that you have heard about getting vaccinated, or even the virus itself. So anybody wants to jump in?
I'm willing to say something. I have heard people around me, not necessarily people that I associate with, but just people that I've heard say that, like I've heard women express that they're worried they might never have children once they receive the vaccine. And I have heard also women with underlying like health issues express concern that it could worsen their health issues. And I have had people who, like, I know people who have had COVID and who still will not receive the vaccine because they don't know what's in it. And so those are just some of the things that I have heard around me here. Yeah.
All right.
Doctor, you want to say something?
In terms
about
of fertility, just recently they had some studies come out and dispelling the myths about it. They took literally like particles of what the, oh my goodness, the basics of the vaccine, of the mRNA vaccines. And they marked them and to detect it at different stages of pregnancy and if they were able or viable. And definitely, they concluded that there's no affecting of the fertility. Okay. We've seen also, with other viruses, we've seen immediately when cases that have affected some developmental issues on the babies and stuff, immediately, like remember the Zika virus, you had a chance of being of having a kid with an encephalic, or there were issues that were detected immediately. And in this case, we've had very publicized cases of women that have been given birth and even had the virus and no issues. And so that's a myth that we have to dispel, because it's very prominent among the young people. Also about the vaccine, how fast it was done. Well, this vaccine has been a work in progress for over 13 years. And this had to do with that SARS virus that we had. It's a coronavirus as well. And so they started to develop this as well.
So it was not
It was not fast.
last year to this moment development. It has been.
They just had the building blocks already and the studies to back up and speed up what they could do.
It's like they had the foundation of.
Correct.
That's interesting. And it was a global effort as well, right?
Also, it was not something that was, people always associate developments like this with big pharma and the money that they can get, that's we understand the sentiment, but this was a global effort to try to get something to work against the virus, because it was a big threat, and they treat it as such.
Thank you, doctor. Any other myth that either Cheyenne, Gabe, or Rachel you have heard from your communities? Who wants to jump in?
I can. Some reasons I've heard that people don't want to get it is that the vaccine came out too fast. Once having COVID, you're all of a sudden immune to it. Not really trusting it. And some people that I went to school with are guilty of believing things on social media and not trusting actual resources that give you facts.
Yeah, social media, I've seen that a lot, even among members of different groups of color. People of communities of color have kind of like, especially since we are so social, and in my experience has been that given the fact that, like Jasmine was saying, we were not able to go out and be with each other. So now people spend a lot of time on social media, on the internet, and a lot of misinformation is present, and they don't trust some people like Dr. Ramos and Dr. Fauci, people who are really, epidemiologists, which is the branch, the medical branch that has to do with this type of studies and responses to a pandemic. So thank you. No, that's so very on point, Rachel. So anything you might want to add to that, Dr. Ramos?
I think social media in general has been influencing people, not only young people, but all ages. We also were talking about earlier about our communities of color and our mistrust to government and health in particular. You know, we've heard the stories, we know the real things that have happened throughout history. And so that's something not to be taken lightly. We need to reach our communities of color with facts. We cannot be judgmental. We want them to open up to facts. And when we explain, usually that is a good start. And we have been able to change. We've seen people change their minds when you really sit down with them and explain. I have the example of one of the developers of the Moderna vaccine, Dr. Kesmikia Corbett, and she has been saying that all along. Like, she recognized her own African-American community was very hesitant, and she has been working little by little to kind of like eat up at that hesitancy and try to convince people in a good way.
Perfect. Thank you, doctor. That's great. And it's great to say that one of the developers, right, of the Moderna vaccine is an African-American woman. So
Yes.
that gives us,
Dr. Kizzy.
yep. So to kind of like wrap it up a little bit, any final thoughts from all of you, exhortations or messages you would like to give to young people out there from all our communities of color who may be hesitant, who are on the edge? What would you say to them? Who would like to start?
I can. If you're eligible to receive it, get it. Don't do it to protect the people that won't or can't get it. Decrease the chances of spreading it to your community and help protect the people of color community. As myself and my lovely associates are doing, we need to work directly with people of color community and just any community in general, these leaders of these communities, and help amplify the voices of people of color to ease fears, build trust, and spread proper information about the vaccine.
Yeah, excellent. Thank you, Rachel. So Jasmine, Cheyenne, or Gabe? Jasmine, yeah.
Yeah, I agree completely with everything Rachel just said. Couldn't have said it any better. And I just want to tell, like, I know our communities, Father Nelson, like you've mentioned, we are so built on the sense of community and social gatherings. And if we want those to come back, you know, just as good as they used to be, then we need to be making the effort to protect the entire community and just to take into consideration our elders and the people who sacrificed so much to bring us to where we are today. You know, if we want to keep them alive and well and healthy, we need to start promoting the vaccine. And, you know, if you've gotten it and you don't regret it, tell your friends, you know, spread the word. I think we need to work together as communities and as people of color. Like, if no one else is going to fight for us, we need to fight for ourselves. And, you know, like, the community itself needs to just spread word within its own community. And I think once that gets the ball rolling, I think more people should get vaccinated.
Excellent. Thank you so much, Jasmine. We need to work together, that's for sure. Find our common humanity compels us to protect each other, right? And regardless of any other, I call them the differences that we create to keep each other apart. We should just forget about them and just, we're human beings and we need to be there for each other. So that's perfect. Beautiful. Thank you, Jasmine. What about you, Cheyenne? What would you say to people who are 18, who are maybe a little hesitant, or they're like, and they don't know what to do? What would you say to them about the vaccine?
Just like Rachel and Yasmin, I would also urge them to receive the vaccine. It is very quick and easy to get it for yourselves. And just like you guys, we also have a lot of respect for our elders. They're very important to us, and to protect them, we have to get the vaccine in order to protect everyone. Yeah.
Thank you, Cheyenne. Gabe, any final words we'd like to share with the community other young people out there.
Yeah. With the surgence of all these new variants and the counting death toll that COVID era has brought upon us, and all these horrible things that have happened, it's important now, as it was ever, to get vaccinated, because you may not get the chance to regret it in the future. Too many people end up in the hospital bed. Too many elders, too many young people end up in a hospital bed, and some of their final words are, I should have gotten the vaccine. Is it too late for me to get vaccinated? Don't let this opportunity of good health that you have now pass by, only for you to not get vaccinated and not be in possession of that same good health later. So I would absolutely recommend getting your vaccination as soon as possible, because it truly is important to your health and the health of those around you. And it's really within your best interest.
Thank you, Gabe. Wonderful. Wonderfully said, my friend. Thank you. And Doctor, any last words from you? Any exhortation to the
Don't
community?
listen to rumors, listen to the experts. Not everybody that has a white gown is necessarily an expert, so be wary of that. Get vaccinated and protect the population under 12. They cannot get vaccinated yet, and we've seen how the cases are growing up on that population, even hospitalizations and bad events. And also mask up. Regardless of any mandates or politicians that don't want to, go by mandates, you're doing it for your community, your family, your community at large. You're protecting everyone, protecting those kiddos that cannot get vaccinated. So please mask up.
Thank you. I want to thank the YCC, the Youth Coalition of California, Jasmine, Cheyenne, Gabe, Rachel, Dr. Ramos. Thank you so much for joining us. And we wish to keep having these conversations. And hopefully we will do this one more time. And it will be because everybody has been vaccinated. All young people have been vaccinated. And I hope and pray that everyone, the young people lead us like they have led throughout history in providing the way forward. So I hope, and it's my hope that you lead us into the next stage of abundant life for all communities, and that you show us the way forward. So thank you so much for your words of encouragement, for your words of support, for your words of promoting health and the well-being of our communities. Thank you so much.
Thank you. With these young people, we're in good hands.
And to that, I say amen. Thank you, everyone. Bye, and take care.